The next bill, Representative Norris again. House File 2354. Please move your motion and proceed with the introduction of the bill.
Yeah, thank you, Chair Noor. I move that House File 2354 be re-referred to the Public Safety, Finance, and Policy Committee.
Please proceed.
Thank you, Chair Noor. Minnesotans are a generous people. When our neighbors and our communities are struggling, we believe in offering them a helping hand. That's why it's disappointing, frustrating, and completely unacceptable when that generosity is taken advantage of. Medical assistance fraud steals from hardworking taxpayers across Minnesota. It also steals money that is meant to provide health care to low-income Minnesotans. That's disgraceful, and we're here today to crack down on this kind of fraud. Attorney General Ellison's Medicaid Fraud Control Unit already does great work catching people who steal from medical assistance and making sure that they're held accountable. Compared to similarly sized states, they've won the most convictions for provider fraud, and with an annual budget of about $5 to $6 million a year, in the last 5 years alone, they have recovered over $53 million in civil penalties and criminal restitution. But as our medical assistance budget grows, so too must the Medicaid Fraud Control Unit. It's a mouthful. MFUCU, I think, is the acronym that they use. After all, it takes people to fight fraud. So this bill does a couple of things. It improves Attorney General Ellison's office's ability to investigate Medicaid fraud by expanding the office's subpoena powers to bring it on par with the same powers that county attorneys have when investigating these sorts of cases. It also brings the penalties for medical assistance fraud in line with other theft penalties, including a maximum penalty of up to 20 years in prison and a fine of up to $100,000 if you steal $35,000 or more. And lastly, we've seen a lot of attention on fraud related to grant programs in the Minnesota House. And while scrutinizing grants is important, for the Department of Human Services, only about 3% of the funds that go out the door are in the form of grants. Medicaid accounts for 89% of the funds that go out the door. So this bill is designed to scrutinize and make sure that we have program integrity on the largest source of funds that Department of Human Services provides to Minnesotans. And with that, Chair Noor, I have a couple of testifiers to provide more detail.
Welcome to the committee. Please introduce yourself for the record and proceed.
Chair Noor, Chair Schumacher, members of the committee. I'm Nick Wonka, the director of Minnesota's Medicaid Fraud Control Unit, which is housed in the Attorney General's office, and I'm here today to testify in support of House File 2354, otherwise known as the MAP Act, which will help ensure that we in Minnesota continue to be able to investigate and prosecute fraudsters who steal taxpayer dollars that should be dedicated to providing critical health care services to Minnesota's most vulnerable populations. Minnesota's Medicaid Fraud Control Unit has existed for over 40 years. We're one of 53 in the country. Every state has one, as do DC, Puerto Rico, and the U.S. Virgin Islands. Each one of us is funded by a federal grant from the Department of Health and Human Services Office of Inspector General. That grant covers 75% of our funding and comes with conditions on what we can and cannot do. It requires us to spend 100% of our time investigating and prosecuting Medicaid provider fraud and the abuse, neglect, and financial exploitation of vulnerable adults residing in certain settings. And as you can see from the handout, our investigators and prosecutors are good at what they do. Over the past 5 years, Minnesota has only spent about $5 million in state funds on our Medicaid Fraud Control Unit. In that same time, our units won $53 million in restitution and recoveries from fraudsters. But with those federal requirements come certain prohibitions too. We're the investigators and prosecutors, but we aren't the administrators of the program. For example, our federal regulations require us to be entirely separate from the agency that administers the Medicaid program, which here is DHS. So we can prosecute it, but we can't turn off payments on the front end or bar a certain provider from enrolling with Medicaid or continuing to receive payments. We also can't investigate or prosecute fraud in obtaining benefits, also known as welfare fraud or fraud in other public programs. But those limitations have allowed us to specialize and be skilled at what we do. Our numbers back that up. We get audited from time to time by the Federal Office of Inspector General, and last time they looked at us in 2022, They noted we had more fraud convictions than other similarly sized Medicaid fraud units. We've continued that trend in the past few years as we've outpaced even larger, more well-funded units in provider fraud charges and convictions. So what we're asking you for today is the tools and resources to continue keeping up that good work. Minnesota's Medicaid budget has grown quite a bit in the past few years, but our Med Fraud unit has not. We're at 32 people right now, and it's a dedicated group of skilled investigators, prosecutors, analysts, and legal support staff. What we're asking for is simply to match the recommendation for our unit staffing given to us by the Federal Department of Health and Human Services Office of Inspector General. They calculate our staffing needs based on the size of our state Medicaid budget, more Medicaid dollars being paid for services, more staff needed to investigate fraud. That's why New York, California, Florida, Texas have hundreds of people, while South Dakota only has a handful. Our recommended number right now is 41, and that's what we're asking for. Be 9 additional people, 1 prosecutor, 7 investigators, 1 support staff. But the state would only be paying for 2 1/4, because the federal government will pay for the rest under our grant. And with those people and the additional tools we'll get through the MAP Act, we'll be better able to continue our mission to hold fraudsters and abusers accountable for their crimes. Thank you.
Thank you so much for your testimony. Do we have anyone else who wants to testify? Mr. Musab Khalif, welcome to the committee. Please introduce yourself and proceed with your testimony.
Thank you, guys. Chair Noor, Chair Schumacher, and esteemed members of the committee. My name is Musab Khalif with the Community Provider Alliance. To start, we would like to express our support for this bill's overall objective, especially the provisions in House File 2354 that increase funding and expand the authority of the Attorney General's office to address fraud. However, we have some critical concerns regarding this bill, specifically Section 3, lines 2.14 and 3.33, which we feel need to be modified with more precise and unambiguous language. To save us time, we won't go into the details of what we mean by that, but without having clear and precise language, as the Supreme Court of our state has said, then it's kind of going to be a free-for-all. Laws are going to be subjectively applied as opposed to objectively applied. In conclusion, we support the bill, but we have concerns about it, specifically the language and the potential impact on individuals' right to due process. We hope that the bill's proponents will work with us to address these issues. Given our preliminary discussions with these proponents of the bill, we're confident that we're going to come to an agreement in addressing these issues. Lastly, I would like to end with this. As we are discussing the broader theme of fraud and abuse, I would like to press upon you guys that there is a trade-off of having too much regulation and the impact of that on providers. Having providers being efficient will also save us money. We have a looming crisis with a lot of people coming into Medicaid and Medicare over the next 10 years. Senator Hoffman endearingly calls them the silver tsunami, is what he calls it. That's going to be very expensive for our state to handle. And it requires us to address and go after these thieves harshly. But simultaneously, we must make sure that providers are not feeling scared so they don't innovate, they don't iterate, and do better with their operations. The two have to go hand in hand. And having good laws that are clear, unambiguous, precise, will help us get there. Don't take it from me. Take it from the Minnesota Supreme Court, who said the current tools the normal tools that they use to address and interpret the laws are not useful because the laws haven't been updated for decades. We need the laws to be clear. Sorry for going off on a tangent, but I think it's important for you guys to have a comprehensive understanding of what's happening, right? Both sides. Thank you, guys.
Thank you for your testimony. Do we have anyone else who wants to testify on this bill? Seeing none, members' discussion. Don't see anybody. So with that, your closing remarks.
Thank you, Chair Noor. Want to thank the Attorney General's office for bringing this bill forward. Obviously, I think this is a good step that we should be taking to make sure that we have program integrity in our Medicaid units. I also think it's great to highlight that this is going to be a 3-to-1 match from the federal government. So when you look at what this unit has been able to recover in terms of fines and restitution, you combine that with the fact that the federal government will be matching this small state appropriation 3-to-1. I think this is a real winner, and I would ask for the committee's support.
With that, I renew my motion. Representative Norris renews his motion that House File 2354 be referred to Public Safety, Finance, and Policy. All those in favor, please say aye.
Aye.
Opposed? See none. The motion prevails. You're on your way to public safety. So thank you so much.